Good afternoon, folks. This is Robert Chappell, Executive Editor at Madison365 with your daily update for Friday, July 30th. The last day of the week, almost the last day of the month, and on we go. Before we get into the news, we have to recognize our sponsor for today, Community Shares of Wisconsin, and their Backyard Hero Awards. Community Shares of Wisconsin marks its 50th anniversary, recognizing volunteers and leaders with Anniversary Backyard Heroes Awards. Marianne Martin and Joan Caron were Community Shares board members for decades and both served terms as board president. Marianne was a board representative for Women's Transit Authority and then for Commonwealth Development, where she served as the executive director for 35 years. And Joan Caron served as a board representative for Disability Rights Wisconsin and has been a key advocate for disability rights within CSW's membership. She continues serving as a mentor and advisor to staff. And thank you to our Anniversary Backyard Heroes for everything you do for the community. Let's talk COVID first. We got some other news to get to, some stuff happening this weekend that you want to know about, some stuff that feels a little bit less weighty than this COVID news. But the COVID news today, we may want to linger on. If you have any questions about anything, drop them in the comments. We want to I want to know what you want to know, right? So we can make sure we get you informed on what you need. Because today it's not looking good, guys. It's more than 1,000 cases today for the first time since February 7th. We are confirming 1,058 new cases. That bumps our 7-day average up to 638, which is quite a bit higher than it was yesterday. Yesterday was 552. So our daily average went up by 80. Also of concern, our positive test rates is, you remember we want it to be below 3.0. Yesterday was 5.5. Today we're at 6.1, which is that's the highest that's been. Let's see, since January 23rd, it was 6.0. Now, that positive test rate, take that with a tiny grain of salt. 6.1 is unmitigatingly bad. We're not gonna try to explain it away. We're not going to try to pretend that it is okay because there's less testing. But the fact is there is less testing. And when we look at 6% in January versus or even 6%, we didn't hit 6% last fall until September 9th. But there was a lot more testing going on in September of last year, right? Remember, the Atlanta Energy Center was open. People were just driving through testing. There was community testing sites in Milwaukee and Green Bay and all over the place. And there was a lot of people getting tested who, just out of caution, right? Which means there were a lot more negative tests. And there were also a lot more positive tests. I mean, there were as many positive tests as there are now. So there are as many positive tests as there are now, but more negative tests means the positive test rate would be lower. Now, with less testing, we're not doing the sort of surveillance testing, right? The people who are getting tested are either people who get tested every day, healthcare workers, that kind of folks, or people who have been exposed, or people who are showing symptoms, or people who are getting admitted to hospitals for other reasons. If you're in a car accident right now and you are admitted to the hospital, they're going to test you for COVID just to make sure. And every once in a while, that'll pop up a positive case. What that means is those people who are getting tested are just more likely to be positive than they would have been back in January. So in some sense, if we were doing the same amount of testing now that we were doing in January or September of last year, our positive test rate would be considerably lower. Let me give you an example. Let me explain it a little better. On September 7th last year was we were at 6.2, okay, percent positive, and that was with 1,200 new cases. Okay, now we're at just over 1,000 new cases. We're still at 6.1, which means we just have fewer tests overall. I hope that makes some sense. The 6.3%, 6.1% rather, still no way around it. That's bad. What's also bad is the rate at which it's going up. Right? I'm going to show you something here. I'm going to show you this dashboard, which you can see anytime you want to at the DHS website. This is their dashboard here, and I can't really zoom in on this very well, but perhaps you can see. I don't know if you can see my little cursor here, but in the middle right there, you can see percent of positive by test is 6.1. And you can see right down here, this little very steep upward angle on this little graph here. You'll notice how this is like September, November last year, how steep it was. It's that steep upward again. So again, it's not just the number 6.1. We tend not to look at numbers in isolation, right? We try to look at numbers in as relates to trends, right? And the trend right now is upward. And it's not just upward, it is steeply upward. And part of the reason that it is steeply upward is Delta variant. Now we get our variant updates on Thursdays. Although the state has changed the way they report the variants a little bit, so I wonder. And so the only reason I got it on last night, was that I would look for it on Thursday. So it's possible that this new way they're doing it, which is they're leaving it up to to a different state agency. They might actually be reporting it more regularly. So I'm going to keep an eye on that. But here's the thing. For the week of July 11th, which is a couple of weeks ago now, but that's the most recent week that we have full data reported for, they sequenced 41 samples of COVID infection. Of those 41, 30 were Delta variant. That's 73%. And now that is supposedly a representative sample. So you could sort of generalize that and say, if there's 1,000 new cases today, roughly 730 of them will be Delta variant. The samples overall, not just that week, but overall generally, have disproportionately come from South Central Wisconsin. That's the other thing we noticed last night. Dane County is kind of overrepresented. Milwaukee County is overrepresented in those sequences. However, that's probably okay because there's no reason to believe Dane County is going to be significantly different in terms of variants than the rest of the state. So assuming that's relatively representative, it's reasonable to think that right now between 75 and 80% of our new cases are Delta variant. Delta variant is significantly more contagious than original COVID, which was very contagious, right? The whole problem with this coronavirus to begin with is that it's just really contagious, right? It's very deadly. It's like 1% infection fatality rate, which doesn't sound like a lot, but that's a lot. That's high when it comes to viruses like this. But it's also very infectious. So now Delta is here, and it's even more infectious. So that's the combination of the prevalence of Delta variant, alongside lack of vaccine, is what's definitely was driving this surge. We now have 57 counties that are considered to have high activity level. We have 15 counties with medium activity level, none with low right now. 51.9% of Wisconsinites, this is the entire population, including children, almost 52% have gotten one shot, 49.3% have completed the series. That number has been pretty stagnant. It's going up by like a tenth of a percentage point every couple of days. We hear reports that nationally vaccines are going up as people, sort of grapple with the reality of this current situation. In Wisconsin, it has actually gone up, but not very much. 7-day average is now 5,900. That was 5,700 a couple of days ago. So that's good. We got to keep that going up. But I think I have said this before, but I think that a lot of what's driving the vaccine problem is complacency. Right? There's a certain small group of people that are just opposed to vaccinations. There are a relatively significant amount of people who would just have barriers, right? Have trouble getting the vaccine. I can't take days off of work, don't have transportation, that kind of stuff. But I think a lot of it is just like people who just haven't got around to it yet and who are now being prompted finally to get around to it because of the surge. So I'm hoping that prompts people those type of folks hurry up and get it. Thank you for your questions, Rachel and Lisa. I'll get to them in just a second. And one other number I want to mention is 246. That is the number of people currently hospitalized in Wisconsin. That's up from 223 yesterday. 23 more hospitalized today than yesterday. That's not a big number. Okay, we don't talk about overburdening the hospital system until we get to several thousand. Okay, so the hospital system is in decent shape to handle the population that it has. However, what that does tell us is that the infection that is spreading is causing severe illness, right, and will likely lead to more deaths. The hospital population has increased by 58% in 1 week. With the positive test rate, with the number of cases and the positive test rate surges, hospitalizations surge a week or two later. So this hospitalization surge really reflects what happened, a week or so ago. So I would expect that to continue to go up. And then I would expect deaths to go up in the next 3 or 4 weeks, which is difficult to anticipate, but that's probably what's going to happen. This is a great question, Rachel. Is there any data around how many of Wisconsin positives are vaccinated versus unvaccinated? No, not that's been readily made available. I've been asking around. I emailed DHS. They're very busy, so they're not trying to hide it. They just sometimes aren't able to get back to us right away. But that's one thing I'm trying to find out. And if I do, I will let you know about it right here. But I don't. It's not part of their dashboard or whatever. And Lisa asks, any news of a possible mask mandate in Dane County? No. I will say the Dane County has issued a recommendation. Milwaukee County has issued now a recommendation today. I don't anticipate mask mandate. Dane County, cases are going up in Dane County, but not by I shouldn't say that. It's going up a lot. It's like, in the 50s and 60s when it was like 7 a couple of weeks ago. But most of the, 68% of Dane County is fully vaccinated. So even those positive cases, if you're vaccinated, is not going to be that serious. So I think masking is recommended. Masking meaning when you're indoors in a public place, like your office or your grocery store or whatever. Outdoors, you don't need a mask. But I don't anticipate a Dane County mask mandate for the two reasons. Number one, just the level of vaccination that's already happened here in Dane County. And secondly, just fear that it's not going to hold up in court and you don't have the resources to fight it in court. You'd rather than put resources into enforcing a mask mandate, let's put those resources into finishing off the vaccine. That's what I think their thinking is. Like the mask mandates were meant to get us by, to help us all survive this thing until we could get a vaccine. Right? Now that the vaccine's available, the priority is going to be to get the vaccine into the people. Does that make sense? This is another great question from Rachel. From businesses or agencies mandating vaccine. I haven't heard anything specific to Madison or to Wisconsin. I would imagine that there are probably some employers who have started to talk about this. I haven't heard of any. We'll be asking around. We'll be listening. If there's any government agencies that do, I am certain we'll hear about it. The federal government is mandating vaccine. They're not saying that. What they're saying is if you're not vaccinated, you have to get tested once or twice a week. You can't travel for work. You got to stay masked at work. You have to stay social distance at work. It's basically going to be difficult to work for the federal government if you're not vaccinated. And there's a substantial number of federal employees in Madison and in Wisconsin, frankly. I can't imagine that the state will do that, because just given the current state of affairs politically. I could see some school districts. I could see some cities mandating that staff get vaccinated. I could see some larger employers. But I do not have any specific information about that. Yes, vaccinated people can definitely spread Delta variant. I keep saying Delta virus. Delta variant can certainly be spread by people who are vaccinated. However, if everybody you're spreading it to is also vaccinated, that's less of a problem, right? But what you're saying, Lisa, is exactly right, and that's exactly the reason that masks are being recommended. Right? They're saying even if you're vaccinated, put a mask on so you don't breathe it in and you don't pass it on to anybody else who might be unvaccinated. And rather than try to mandate that, they're going to try to get more people vaccinated so that even those of us who are breathing Delta around are just breathing it to other vaccinated people, and nobody gets really, really sick. I think that's the thought process. Yeah, thank you for sharing this, Corey. Corey had a negative test, but since you were symptomatic, recommended isolating for 10 days. One thing that when I was tested first last April. I had symptoms, and I tested negative, but they told me whatever if you clearly have some sort of virus. Like, it's not COVID, it's not coronavirus, but it's probably something contagious. So why not just even if it's not COVID, isolate yourself so you don't get anybody sick. I don't think it was COVID, but for that reason, still, these tests are not 100%. You can get a false positive, you can get a false negative. But you're 100% right that this thing is very, very contagious, and therefore very, very dangerous from a population perspective. So, as I mentioned, Dane County, the CDC, and Milwaukee County all basically asking you, please put a mask on when you're in public, indoors. It's almost impossible to actually enforce that, but it's recommended. So please do it. That's kind of the message. All right. We will. If you have any more questions, feel free to drop in there. We'll get to them. We're going to take a short pause. Hear from another sponsor who is generously helping us out. Keep this on the air and free for you. And we'll have more news on the other side. Give me 15 seconds. Don't scroll away.
Hi, my name is Megumi. I serve at AmeriCorps because it is the perfect opportunity to work with middle school students and to grow in important skills such as leadership, responsibility, and communication. You can serve too. Learn more and apply at www.passamericorps.org.
All right. Now let's talk about something a little happier. Our fifth installment of our most influential Native American leaders list is up today. We got a couple of Oneida tribal leaders. We got some folks who work in other outside their tribes, outside their nations. But this is the fifth installment of our 24 most influential leaders who are members of indigenous nations. We often talk about indigenous folks as if they're in the past tense, right? We talk about remembering their rich culture and things like that, which is funny because those rich cultures are right here, right now. We just got to get to know them, right? We got to open ourselves up. So there's a lot of people doing good work within their nations, taking leadership roles within their nations and doing good service work within their nations. And there are folks of those nations who are doing great work, at a bank or at a law firm or at social service agencies in the government, in the state government. So we want to just introduce you to some of those folks. We did this last year as well. This is our second time, so read through that. This is the fifth part that we published today. We did a 5-part series, and I'm going to post the entire list tomorrow, so watch for that. Also in the news today, tomorrow, you can go to Disability Pride of Madison. They're not calling it a festival this year because it's going to be smaller. It's a gathering because, folks with disabilities were disproportionately impacted not only by COVID, but by the isolation that has come from the pandemic. A lot of folks with disabilities have suppressed immune systems for a variety of reasons, have trouble getting out of the house anyway, in many cases. But this is an event. This is Madison365.org right now. Angelica Eastery has the story for us. Take a look at the details, learn a little bit more about the event, about the organization, and everything like that at Madison365.org. Also on the site today, Milestone Democratic School is a high school designed by youth. They're designing their own education, right? They're going to have an event tomorrow from 1 to 5 to introduce you to the school. It's on Madison's east side. They're going to have music and food and sort of a town hall meeting where you learn about the school, about its philosophy, about the sort of non-traditional way they do grades, the way they demonstrate what they learn. It seems to be a cool concept, and they're trying to, open the doors for more students to join and to come to the school as an alternative. So you can stop by there tomorrow if you want to learn more. And Dave Dahmer has that story on our website right now, Madison365.org. The Boys and Girls Club of Dane County is hosting I got to get the name of this right, so give me a second. The MLB pitch, hit, and run events. This is, you've heard of punt, pass, and kick, what the NFL does. MLB is doing this now, pitch, hit, and run. This is going to be on Wednesday, August 4th, and Tuesday, August 10th. It's an opportunity it's designed to provide youth an opportunity to compete for free. Competition that recognizes individual excellence in core baseball and softball skills. Have a good time. See what you can do. It's going to be at Warner Park from 10 to noon. That's where the Mallards play. And the Mallards players will be volunteering during the event and will be donating lunch and ticket vouchers for future games. So you can go to Madison365.org right now to register for that. And then the August 10th event will be held from 1 to 3 at Olson Field behind Thomas Jefferson Middle School on Madison's west side. So take a look at that if you have a kid who's interested in baseball or just getting out and doing something fun. Also want to mention the FAM, our new membership program. Now more than ever, it's really important to be informed. We've learned that last year through COVID. knowing what's happening is just super important. And we want to do that for you. We want to keep you informed, especially the communities of color. We want to keep you informed without making you pay for it, right? We're never going to make you subscribe. We're never going to hit you with a paywall or anything like that. However, we still need money to run, right? We're a 501c3 nonprofit organization. We run on donations from folks like you. We have sponsors, as you saw the ad a little bit ago. We have sponsors that help us out, right? But it's really the community support that makes the thing happen. So if you want to join us, become part of our fam, you can do that for as little as $5 a month, $10 a month, $25 a month, whatever's good for you. Go to Madison365.org/thefam. Help us keep it free for everybody else who maybe can't afford the $5 a month. I'm going to put a link in the comments so you can just hit that link, head over there. It's a couple of clicks, and you're in. You get a little sticker for your laptop. You get some notifications a little bit early. You get some additional content, a little bit extra stuff just to show our love to you. So we'd appreciate it if you give that some thought. That is all I have for you today. I hope you have a wonderful weekend. Stay safe out there. Keep your masks on. All right? Keep your distance. Do all that. We got to get back to that, unfortunately. And if you haven't done so yet, get your vaccine. All right? Thanks a lot. Have a good weekend.
This is 365 Media.